Today, Rebecca, we will be introducing you to the program team. We'll be providing you with some information about the structure of the program. Dr. Medina is the module leader for neuroimaging, and Dr. Nettison is the module leader for psychopharmacology. And they're going to do a taster session with you. And at the end, we'll talk a little bit about the careers that graduates of the program have been successful in, and then we'll open it to your questions. Our team consists of our program director, Dr. Alice Egerton, and then, of course, I've introduced you to Dr. Medina's, and she'll speak with you shortly. We also have module leaders for psychiatric genetics, research methods, ethics, statistics module, and so forth, as you see there. If you do need any support during your studies, you can contact myself as the program administrator or Dr. Katerina Kutsatani, the programs manager. So this is the overall structure of the program. There are the core modules. There are 3 of them: the research methods, ethics, and statistics and mental health, advanced statistics, and designing, funding, and publishing a study. And then, of course, at the end, you do the research dissertation. The research methods, ethics, and statistics and mental health is the first module you'll do, and that module will start in September. And then you'll go on into the second term, as you see on the side here, format and assessment. In term 2, you will choose 4 of the optional modules, and you will complete that up until March. And then in term 3, you will do the advanced statistics, designing, funding, and publishing a study, and you'll be working on your research dissertation. The optional modules are listed below, and as you see, we have a really interesting range of topics that we cover. Again, you'll have an opportunity to hear directly from the module leaders of the neuroimaging as well as the psychopharmacology. But if you'd like to meet or have a chat with any of the other module leaders, you're welcome to send me an email, and I'll be happy to put you in touch. And so now I have the pleasure of introducing Dr. Jemma Medina. She's the neuroimaging module leader again, and you see here some of the great things that Dr. Medina has been involved in, and I'll pass it over to her so she can talk a bit more about it.
Thanks, Siobhan. Hi, Rebecca. Thanks for calling in. So I'm just going to give you a brief overview of what we cover in the neuroimaging module. So as Siobhan said, this is one of the optional modules, and I lead it together with Dr. Montserrat Fuster. It's the 2 of us. And well, as you can see here, we can produce very beautiful pictures with neuroimaging. And neuroimaging involves all sorts of techniques. So we can look at the structure of the brain, we can look at the function of the brain, we can look at metabolism, neurochemistry, and we can also look at the connectivity of what matter fibers. So at the end of the taster, I'll give you an overview of the program so you can see exactly what are we covering and how we structure the module so that you can go from an understanding of the basic principles of brain imaging to how we apply this to psychiatric populations and where we are today with this. So basically, the module is aimed at equipping you with being able to answer questions such as what can neuroimaging tell us about the brain in psychiatry. There's a strong focus in psychosis because here in the department there is quite a significant body of research around psychotic disorders, but we'll also cover, of course, other psychiatric diseases. And some of the questions that we will introduce is whether neuroimaging can tell us anything useful. Has it told us anything useful about the etiology of these disorders? So how they happen, what's the cause of them, if we know that they are disorders of the brain? Can also neuroimaging tell us not only from a knowledge perspective, but also can it tell us something about diagnosis? Can it help the clinician in making a diagnosis about specific disorder or specific symptoms even? And the third important aspect is how about therapeutics and pharmacotherapeutics? How do these different compounds work in the brain and how they modify the brain systems involved in a given disorder and how that translates then in modifying behavior. So these are some of the main questions that we cover. Again, more pretty pictures for you. So we have an MRI machine which looks like this. The subject lies inside the scanner. There's a coil on the subject's head that then help us with the magnetic field to capture the image. And we can do functional MRI, as you see here is the photo with the blue blobs and the red blobs. And we can see what brain areas are activated when someone is doing a specific task, thinking about specific things. With DTI, a diffuser tensor imaging, we can look at white matter integrity. So how different areas of the brain, how the hardware of the brain is affected in different disorders. So less effective connectivity, for instance. With MRS, that's magnetic resonance spectroscopy, and we can look at different concentrations of different neurotransmitters. So we can look at glutamate or GABA in different parts of the brain. That's the graph that you see there. Then with structural MRI, we just see the structure of the brain, and we can look at gross, differences or even regional differences between patients with depression and healthy controls, for instance, or patients with depression before and after treatment, etc. Then there's pharmacological MRI, so some group of individuals will be receiving placebo, group of individuals will be receiving, say, cannabidiol treatment for a period of time, and then you can compare changes due to the administration of a certain drug. We not only going to cover magnetic resonance imaging, we also do neuroimaging with PET, positron emission tomography. And it's a similar looking sort of donut-shaped machine, but it doesn't involve a magnetic field. So you can see the subject laying there a little bit more happy. It does involve radiation though. So there's the intravenous administration of a radioligand that then goes up to the subject's brain and binds to specific receptors of interest. So here, for instance, there's this Pittsburgh compound, which in Alzheimer's disease binds to specific receptors, and this binding is increased rather than in control. So it's actually a way that it's used for diagnostic purposes. Right, so also the good thing about neuroimaging is that instead of looking just separately at the structure and the function and the chemistry and dopamine, we can actually put these things together in what we call multimodal imaging. So we can look at interactions between, say, glutamate levels in a specific area of the brain with brain activation in that same region or structure in that same region. So this is interesting for answering kind of wider questions in psychiatry than you would with separate modalities. And then also, of course, we can answer wider questions, not only comparing groups of people, but we can also map the effect of environmental risk factors on the brain, whether childhood trauma has an effect on brain structure or given genes or interactions between genes and environment. We can map the normal brain maturation waves in normal developing adolescents and then see whether that's different in childhood onset schizophrenia, etc. So that's all this wide range of applications that neuroimaging can have. And just to finalize this little introduction, just to give you an overview of what we cover. So just for you to know that it does include quite a range of topics, but they are tailored to neuroimaging. So when we're talking about basic physics, that will be physics that are applicable or relevant to a neuroimaging study. We won't be going through neural anatomy, for instance, at the cellular level, because that's not something we can map with imaging. Yeah. So we'll start from scratch with an introduction and the history of neuroimaging in psychiatry. Then we move on to basic physics and MR safety. Of course, you can see there a chair stuck into a MR scanner, so it's a high magnetic field. Basic physiology as well, and then some neuroanatomy. Introductions. From here, we also have data analysis and practical workshops, so you will have access to computers and with data sets, with functional MRI data sets, and you'll have a specialist from the neuroimaging center walking you through how we do analysis of neuroimaging data. We're also going to go to the scanner itself, so we'll have like this field trip, all of us, and we're going to go there, and the physicists are going to show us how it works, how we put the subject in the scanner. We're going to scan someone in real time, and you'll see how we obtain the brain images and how that works. From there, we'll move on to specific techniques. So we have functional MRI. We'll dedicate quite a bit to it because it's more complicated, the design, than some other techniques. We'll cover the techniques that I've mentioned in the last 2 slides. And we'll also talk about putting clinical populations in the scanner. So there's quite a few issues, ethical issues, practical issues involved in that. So there's also a lecture in that aspect. From there, once you have this strong basis, we can move on to applications in psychiatry. So what we know with neuroimaging from psychosis, violence, affective disorders, etc. How to interpret fMRI studies and neuroimaging studies in general. So how to be able to critically assess a paper or a study. And then we also talk about neuroimaging in the media, because nowadays everything with the word neuroscience or neuroimaging seems to be something that receives a lot of attention, but at the same time it could be taken out of context. So it's important to know how to report these findings. And then we also provide a workshop on the coursework that we have for the module. And that's it from us.
Thank you very much, Dr. Medina. I'd like to welcome Catherine. She's joined us. Thank you for attending this webinar. We're now going to hear from Dr. Shrila Nettison. He's the module leader for the psychopharmacology optional module. And here's some information about Dr. Nettison. I'll pass him over now to you.
Okay, thank you for joining us. I'll just have a brief overview of what the module offers. So that's the first slide, yeah. So psychiatry has, in the past 60 years, it has made quite a few advances, and we see now people treated much better than what it was in the past 60 years. Thankfully, it has been due to the introduction of a number of new drugs. A lot of these were discovered by serendipity, but now we understand them in a much better way. So this course would guide you through them. We would take you through some of the diagnostic measures that we have and how we classify psychiatric illness. So the course is divided into 2 sections. So a clinician will present how the various illnesses are classified, how they're rated, and then it will be followed by talks on how drugs for each class work, as well as how they're used in the clinic. So that's the balance for each of these subjects that we are going to talk about in this course. If you look at the major mental disorders, so we're going to cover them individually in separate lectures. They range from mood disorders to psychotic disorders, as well as anxiety and also cognitive and developmental disorders. So as we go through each one of these subjects, we will talk about their etiology, the diagnosis, the clinical presentation, as well as how drugs work and how treatment strategies are planned for each of these categories of illness. Not only that, we also look at the basic mechanisms, the targets at which these drugs act. So the more we know about where they act and how they work, it improves our understanding both not only of the illness but also of the side effects, the adverse effects they have, and so the quality of care that we can provide to these patients is improved much better. So some of these targets you may not have heard them, but if you look at most psychiatric drugs, they fundamentally act on these 5 molecular targets. As you do this course, you'll understand more about them, but just to give you a brief glimpse of where exactly these drugs are going to act. So some of them act on what we call as transporters. They act on proteins called as receptors. Some act on enzymes. some act on channels which are driven by voltage differences across, cell membranes. So now each one of them has advantages and disadvantages. So we would go through them. I mean, if you look at, every day we have either caffeine, as people smoke, we have a number of drugs that we, not drugs, but it's part of your food or your lifestyle that we have, and we really don't understand unless you've gone through a course like this, where exactly they act and how they bring about their actions. So it's quite an interesting course, interesting module, where you will not only look at a lot of other substances that act in the brain at various targets. So not only do we identify where they act, but we have to quantify them as to, how is one drug better than the other. So for that, we use a few terms like affinity, efficacy, how much of the receptors or target, they occupy, how do they inhibit enzymes, and what is their final functional outcome. So the way we quantify it involves a little bit of mathematics, but it gives us clarity on how exactly they bring about their action. Now, it's important that not only we learn how drugs affect behavior, but we have to also understand how the body influences the drugs that are in the system. So, drugs have to be absorbed, they're distributed, they have to be eliminated because they can't stay forever in the body. So, it's important to understand the basic principles behind how drugs are absorbed and how they're distributed. So even, if you must have encountered, having to take a drug twice a day or thrice a day, but if you ask them why do we need to do that? Now, the pharmacokinetics under which it all comes explains the mechanism behind how long and how for what exactly happens to the drug inside the body. So this particular aspect will also be covered in this course. It's very important to understand this because a lot of side effects or adverse effects are influenced by these factors. So as we cover all these aspects of the course, we do cover topics of current interest, maybe if it's cannabis or the recent advances that have been made to treat depression, psychedelic drugs, and what's popular quite right now is the role of the immune system in a number of psychiatric illnesses. So these are current topics of interest. They're covered by people who are working in these areas, and they'll give you an overview of the current topics of interest. So hopefully this is what that'll be covered in the entire module over a period of 2 months. Now you have your clinical trial rotations also. You have your clinical rotation rounds. So what we encourage you to do is to take these principles of what we teach in the course, and as you observe patients being treated, we want you to also rationalize the medications that have been given, and also to understand how pharmacology influences these decisions. Now, as you do the other modules, for example, neuroimaging, which was talked about recently, genetics or clinical trials, pharmacology would come in all these aspects. There'll be elements of it in all these modules too. So that's the brief overview that I would like to share with you at this moment. And if there are any questions, I think as the session proceeds, you have an opportunity to ask. Okay, so thank you.
Thank you very much, Dr. Nettison. Of course, we've mentioned that there are 6 optional modules, and you've had the opportunity to hear from the neuroimaging and psychopharmacology, and you will take 4 of those modules in term 2. We also have an option for students to take a clinical placement, which is a good opportunity to work alongside very established researchers and clinicians, and it will assist you in your next step in your career. Student support. We have a student handbook for 2015 and 16. You will receive that during the program induction in September, and we'll provide some dates for you shortly. Keats is basically the student's Bible, if you wish, while they are studying on the course. Keats is the e-learning and teaching service provided to students here at King's, and there you will be able to find lecture slides, coursework guidelines, study materials, and updates about the course. The education support team, EST, if there's any questions about student welfare, you can of course contact myself or Katerina Kusatani, or you can contact the educational support team as well. Personal tutors, every student that is enrolled on a teaching course here at King's College is automatically placed with a personal tutor, and you will most likely meet your personal tutor within the first 2 weeks of starting the course. We have several support mechanisms available, as you see here. I'd like to also highlight the English Language Center as well. They offer in-sessional support and study skills support. And if there are any questions about accommodations, we do have a service available to assist you with that. So here are some important dates. The Institute of Psychiatry, Psychology, and Neuroscience will have their induction on the 21st of September. Enrollment week, as you see, will start on the 14th of September and finish on the 18th. The program induction, we will be sending some information out to you shortly about that, but we don't have the dates confirmed as yet. And then, of course, it's important to know of the first class date, which will be on the 28th of September. And again, you'll start off with the core module, Research Methods, Ethics, and Statistics. In terms of future careers, many of our past students of this course has found very successful careers as clinical psychology trainees, research assistants, research consultants, and some have even gone on to study, for their PhD. So the course gives you a really good foundation for your next steps. I'm sorry, somebody has a question?
We're just checking the questions. If you have any questions, please feel free to type in the question box and we'll just answer it.
Yeah.
I think while we wait for your questions to come through, most of the students typically want to know what's their typical coursework like in terms of their week looks like. Does anybody wants to answer that?
The first part of the course, you probably would be focused on so the core module is to do with research methods, ethics, and statistics. So the first term, you will be the focus is on to develop research methods. So you'll be taught by a core team of statisticians, psychiatrists, as well as other supporting academicians, so that you get the feel for research methods. It's very important that when you're planning psychiatric research, you understand the ethics. So you'll be, especially when it comes to human and animal experimentation, so they would cover that. And a huge amount of time is going to be spent on statistics, which will be dealt with by the statistical team we have here. And from the past experience, students have found this to be very, very useful. So that's term one. In term two, the course load increases drastically, where you have to catch up with the 4 modules that you've chosen. So each module will have specialized lectures, they'll have the coursework. So term 2 is slightly you'll have to spend more time compared to term 1. Term 1 just launches you into and gives you an orientation for the course. So that's the kind of workload between the 2 terms.
Great, thanks. We have a question here from Rebecca. How many hours contact time will I have, and how many days a week will I come in for lectures?
So you will come in as a full-time student 2 days out of the week, 2 to 3 days. 2 days out of the week. In terms of contact time, in addition to the class time, most of the instructors, the lecturers, they are open to having office hours and meeting with students. So you will definitely get the support that you require, Rebecca.
Brilliant.
I'd just like to add that you will also assign personal tutors, so if there's anything beyond coursework, you can discuss with them. Regarding each module leaders, you can also email them directly if you have any queries regarding the questions. The program administrator is also there, and you will really have a hands-on approach, in terms of, trying to help you out if you have any issues regarding the course.
Great. Okay, there's another question here. What have previous students focused on for their final project?
Well, there are several different directions that they have taken. Some has been concentration on schizophrenia and bipolar, different topics of interest. What I can do for you, though, is I can present you with a few of the topics that were chosen by past students. If you send me an email, and you'll see my email address at the end, I would be more than happy to send you a couple of the titles.
Okay, and
wait. Yes, I wanted to say that most of the time, at least in my experience supervising dissertations for this MSc, so you will be able to choose from a range of topics of projects that are offered by different lecturers and senior lecturers in the department. So you could either choose from someone who has already a data set, say neuroimaging, and there's the data that is there to be analyzed. So this person is going to train you in reprocessing analysis of brain imaging and the behavioral data that's associated, and then walk you through how to write that up, and that would be a dissertation. Or other projects are involved writing a meta-analysis of given in some topics, so then you would be trained on how to do meta-analysis of studies and how to write that up as well. So, and also I guess some projects do involve actual data collection. So in some modalities, for some types of studies, that wouldn't be possible, but for other studies there is. So you could actually be involved as well in assessing patients or healthy individuals and collect the data yourself.
Yeah, so that's true. I think in terms of projects, we offer a wide range of projects, and they cover, mostly the optional modules that we have listed here for this webinar. So there are experts in each of these fields, and they offer projects, and then students get a choice to choose from them. So in your first term, you get a feel for what you would like to specialize in, and then based on that, students make a choice. You'll also have your clinical placement program, so you can then also get some idea as to what you would like to specialize in future. And if you are already, if you have experience in this field, then you could pursue them, and you could also talk to your program administrator to find suitable supervisors also. So that's another option.
okay. And then we have another question. How do I go about organizing a placement?
Okay, so the program director will provide a few speaking of clinical placements, I'm assuming, yeah?
No.
I think
Clinical
so.
placement?
How do I?
Let's start with clinical placement.
Okay, and then we'll talk about, okay. So for the clinical placements, we will upload different opportunities onto Keats, and students can then go ahead and apply for those opportunities. Once you're successful, you'll contact me, the program administrator, and I will assist you with preparing for the clinical placement agreement form and all of the administrative work to secure your place.
Yeah, so Keats is the online system we have in our program. So that's the way we interact with all students. So that's just to clarify on Keats. So once you have a placement offer, then you meet that particular person who is going to take charge of you, and then you go around with whatever their specialty is. So they'll take you around clinics, and you spend time with them. So that's to do with the clinical placement as part of the program. Now, if this question is about placement opportunities, then we encourage students to get in touch with their mentors or personal tutors whom we assign. So they are very helpful in if you have doubts about whom to contact, how to choose a particular program beyond your MSc. So they will be there to assist you. The number of opportunities that come within the department, within the institute, within King's, for which you would be eligible to apply. The tutors, the staff are very happy to recommend you to these positions. They write recommendation letters based on your performance and how you interacted with them. So overall, it's an atmosphere that supports students. And I think based on the past, we've had very good placement offers for the students who have graduated from this program. So.
Do you have any recommended reading before I start the course?
Yes, we do have a reading list that I can send you via email. So again, my email address will appear on the last slide, and if you send me an email, I'll be happy to send out the list.
And are there options to resit coursework or exams?
There are options. It does depend on the circumstance. Basically, if a student is unhappy with their mark, they can appeal it, and if it's been approved by the appeals team, then they can go ahead and resit it. I think that pretty much covers. Did you have anything else you wanted to add about resits?
Yeah, anything else you want to add?
Regarding resits, yeah, it's a decision that you take with the program administrator. So they would be able to give you more options there.
Yes. Here, of course, is my information. If you have any questions about the program, or if you'd like to get in touch with any of the module leaders, I'll be more than happy to set that up for you. Also, if you'd like to have a one-on-one Skype meeting, we can arrange that for you as well. I'd like to thank you very much on behalf of the team for taking the time to take part in this webinar, and we hope to welcome you in September.